Hey guys, welcome back to my channel, The ENT Resident. Today I'll be starting off a series where I talk about the different signs that you see in ENT. Today our discussion is going to be the signs that you see in otosclerosis. We'll talk about what is the sign, what kind of sign is it an audiological, clinical or a radiological sign? What is it exactly? Where do you see it? What is the reason behind it? Why is it called so? And maybe some MCQs related to it. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. So under signs and otosclerosis, today we'll be discussing four things. We will discuss about the Carhart's notch. We'll talk about Paracusis willisii. We'll talk about the halo sign and we'll talk about the Schwartz sign. So let's get started with our first one. The first one over here is the Carhart's notch. Now here what we are seeing, this is an audiogram. So this is basically an audiological sign that we are seeing on a pure tone audiogram. Now what is this? What is it exactly that we are seeing? So this here, the red line over here is the bone conduction curve and the blue line here is the air conduction curve. These are all the different frequencies that we see over here. So you can see in the bone conduction curve at around 2000 Hertz, we are seeing a dip. So basically, Carhart's notch is this dip in the bone conduction curve threshold, which is classically occurring at 2000 Hertz. The other name for Carhart's notch is known as otosclerotic notch. Why so? Because we see this in otosclerosis. This notch, why does it happen exactly at 2000 Hertz and not in any of the other frequencies? That's because stapes fixation. We see that in otosclerosis, we see that the stapes is fixed. Now, stapes fixation alters the ossicular resonance at 2000 kilohertz. So, stapes is normally responsible for contributing to bone conduction at this exact frequency. So, when the stapes gets fixed, the bone transmission drops a lot at this particular frequency. Now, the important part to remember here is that this will actually improve after you perform surgery and treat the condition. So, after you perform stapedotomy or stapedectomy, this condition will improve. So, Carhart's notch is actually an eponym. Eponym meaning it was named after the person who first found it. So, Carhart's notch was named after Raymond Carhart, who was an audiologist who was the first one to describe this characteristic notch that you see in otosclerosis. Now, let's talk about some MCQs related to otosclerosis here. So, we know that in pure tone audiogram, we find Carhart's notch in otosclerosis. What do you see in a tympanogram? So, in a tympanogram, we see the type of curve, which is the type AS curve. And we also see that the stapedial reflex is absent in otosclerosis. Now, what is a typical MCQ or a typical presentation? What is the profile of the patient who presents to you with otosclerosis? The typical one is that mostly this will be seen in females more than males, and even amongst females, it is the middle-aged females will come to you. So a typical profile would be like a middle-aged female comes to you with bilateral conductive hearing loss, which is progressive in nature. And this also worsens during pregnancy. So these are all the points that you'll look. If you see, you'll immediately think about otosclerosis. Middle-aged, female, bilateral conductive hearing loss, which is progressive and it worsens during pregnancy. And can you also tell me another MCQ question, which is what is the most common site of otosclerosis? The most common site here is fistula antifenestrum. So these are some things that you need to know about Carhart's notch. Now there's another such notch or a dip-like thing that you see in another disease where we see a dip in the air conduction at 4000 Hertz. This happens in noise-induced hearing loss. So do not get confused with this with Carhart's notch. Carhart's notch is a dip in the bone conduction curve at 2000 Hertz, and this is seen in otosclerosis. So these are the two dips that you should know about. Next, let's move on to the next one. The next sign is the halo sign. Now, halo sign is as you can see from the image itself, it is a radiological sign that we are seeing in a CT scan of the temporal bone. Now, what is this sign exactly? If you look at the image, at the arrow marked over here, we can see that there is a halo-like, the radiolucent ring which is surrounding the cochlea. The structure that you can see, this is the cochlea. So the radiolucent ring is all around the cochlea, and this happens because of the demineralization of the otic capsule. So halo sign is basically a radiolucent ring which you see surrounding the cochlea because of demineralization of otic capsule. And this sign has another name, and it is known as the double ring sign. And where do we see this in? We see this usually in cochlear otosclerosis. We do not see it in stapedial otosclerosis. This is only seen when the cochlea is involved. Now, this happens, as I just mentioned, because in cochlear otosclerosis, we know that there is the inner ear involvement. And whenever you see this sign in the CT scan, this is indicative of the inner ear involvement. Therefore, we'll see a sensory neural hearing loss as well in these cases. And why is it called a double ring sign? Because this demineralized otic capsule, it is forming this halo-like appearance. It's almost like as if there is a double ring appearance forming over here. Now, a few questions to know over here is, first of all, which section of the CT scan will show this sign properly? You have to see it in the axial cut of the temporal bone. And the most commonly affected bone in otosclerosis, we already know, is stapes foot plate. And we have already discussed a few common MCQs that is related to it. And okay, another important question right here. Do you know of another halo sign in ENT which is not this? So we have two halo signs in ENT. One is halo sign on CT scan, which we see in otosclerosis. One is halo sign on the filter paper, which you can see in case of CSF Rhinorrhea. I'll make a separate video on this. You can check it out over there. Next, let's move on to our next term, which is Paracusis willisii. So Paracusis willisii is this clinical sign that you elicit by taking history from a patient. So Paracusis willisii basically means improved hearing in a noisy environment, especially seen in patients with conductive hearing loss. And this is a typical feature seen in otosclerosis. Now let's try to understand why this happens. So normally when there's a lot of background noise, the hearing becomes worse. You're able to hear less in a noisy environment. But what happens in Paracusis willisii is you're able to hear better. So in a conductive hearing loss case, the inner ear function is still normal, right? There is only a conductive block. So when there is a noisy environment, what we subconsciously do is we start speaking louder in a noisy environment. Now, because we are speaking louder, the sound intensity increases, right? Because the sound intensity has now increased, this is able to bypass this conductive deficit that the patient has. As a result of this, the patient is now able to hear better in the noisy environment because the other person is talking in a louder voice. Now, Paracusis willisii is an eponym which was named after Thomas Willis, who first described this phenomena. So that's about Paracusis willisii. There's another term that you may get confused with. The term is known as recruitment in audiology. What recruitment means is that loud sounds become unbearable this is mostly seen in sensory neural hearing loss. So this is the feature of sensory neural hearing loss where recruitment is seen, where loud sounds feel uncomfortable. Whereas Paracusis willisii is something that we see in conductive hearing loss, where we are able to hear better in a noisy environment. So that's about Paracusis willisii. Next, let's move on to Schwartz sign. Now, Schwartz sign is a clinical sign that we can see on performing otoscopy. Now, let's look at the image over here. The arrow is pointing towards this pinkish blush that you're able to see on the tympanic membrane, through the tympanic membrane over the promontory, this area. over here. So as you can see, because has this pinkish blush like color, this is also known as the flamingo pink blush sign. Why so? Very self-explanatory. As you can see from the image here, flamingos have this pinkish color. That is why that's where it gets this name from. Now, in otosclerosis, we see Schwartz sign, but the presence of Schwartz sign indicate one particular thing, that this is the active phase of otosclerosis. It is not just seen in any phase of otosclerosis. Whenever Schwartz sign is present, it indicates active phase. So what happens here exactly? So we know that in otosclerosis, there is abnormal remodeling that happens around the stapes foot plate. In active phase, what happens is there is increased vascularity of this otospongiotic bone, in specifically which lies in the submucosa of the promontory. Because of this increased vascularity, we are able to see this pinkish blush sign right over the promontory through the tympanic membrane. Schwartz sign is also an eponym which was named after Schwartz, who was the one who described this pinkish promontory blush seen in active otosclerosis. So, very important to remember here that Schwartz sign means active phase and not just any other phase of otosclerosis. Another sign that you may end up confusing Schwartz sign with is this is known as the rising sun sign. Now, rising sun sign is basically when you see this reddish hue in the inferior part of the tympanic membrane, now which looks almost like a rising sun. This is a feature that is seen in glomus tumors. Do not confuse rising sun sign with the Schwartz sign. So that's all about the different signs in otosclerosis that we have. I hope you have understood it. If you have any further question on this, please note them down in a comment section and I'll get back to you. Thank you.